December 2019, the first human cases of COVID-19, the disease caused by the novel coronavirus causing COVID-19, subsequently named SARS-CoV-2, were first reported by the official in Wuhan City, China. COVID-19 can be characterized as a pandemic. This is due to the rapid increase in the number of cases outside China over the past 2 weeks that has affected a growing number of countries.
Make no mistake, this is though an emergency in China, but it has not yet become a global health emergency. It may yet become one.
Our country, Malaysia, already achieved the lowest cases among another country until all schools can be operated back. But at the end of September 2020, the number of cases getting increased day by day until achieve 4 digits per day. Why this has happened? This is because of several irresponsible people, which is political person that doing campaign for Sabah election. How selfish are them until the situation become worse?
Malaysia recorded 23 new COVID-19 cases today, of which 10 were imported cases. Health Ministry Director General Dr. Noresham Abdullah said that the 10 imported cases involved 5 Malaysians and 5 non-citizens. Out of the 10 imported cases, 4 entered Malaysia from the Philippines, and 1 from each of the following countries: Hungary, Turkey, Qatar, Bangladesh, Nigeria and Maghribi. Dr. Hisham said that all the local cases were from Sabah.
Semua penularan di dalam negara adalah di negeri Sabah, iaitu 8 kes adalah daripada kluster baru, iaitu kluster pulau di Kunak Sabah, 4 kes daripada kluster Binti Lahad Datu yang melibatkan 3 bukan warga negara dan 1 kes saringan rujukan dari Hospital Sempurna ke Hospital Tawau.
how these political things affect our country now. The things that they can postpone all the election and focus to the flatten the curve first is more important. It is just like wasting our time locked down for 4 months before, and everyone need to work from home, and we almost flatten the curve. But because of these irresponsible people, everything is going back to the worst. The COVID-19 pandemic has caused direct impacts on income due to premature death, workplace absence, and reduction in productivity, and has created a negative supply shock, with manufacturing productive activity slowing down due to global supply chain and disruption and closure of factories. Several industries have been adversely impacted due to spread COVID-19 globally. News reported that the large number of supply chains are affected. It is evident that global economy is grinding to a halt. If the virus meant to be important for a long time, an analysis feared that the global economy may slip into a recession. The section said when economies show too conservative purpose of contraction, as nobody able to predict the reality, endurance, longevity of the virus. The IMF has predicted the global GDP as estimated as 1.6% for 2020, while the figure in 2019 was 2.9%. The United Nations Conference on Development said the outbreak could cost the global economy up to $2 trillion this year. This section due to the pandemic, and some countries will bring down global economy growth to clock in below 2.5%. In order to deal the effects of COVID-19 outbreak, OPEC has proposed to curb oil output. The price of oil has been fallen by about a quarter, and the demand for fuel is expected to decline. Rabobank, a Dutch multinational banking and financial service company, has said that a global recession is certain. If people engage less duty outdoor and avoid work, education, fitness, and entertainment is result in lesser economic activity. Businesses are now facing the challenge of disrupted supply of components to make their products. They have to take into account the large number of quality workforce and factories that temporarily shut. Is it this COVID-19 has a vaccine? The answer is no. There are still no vaccine until now, and for those who are affected with this COVID-19, they are just need to quarantine themselves at the hospital and wait for their swab test turn to negative.
This virus is clearly a virus that is there to stay unless we eradicate it, and the only way to eradicate such a virus would be a very effective vaccine that is scaled up on every human being, so to say, and every which we have done with the smallpox, but that's the only example, and that has taken many years. So it will most probably stay. The other thing is that well, it belongs to a family of viruses that we know, the coronaviruses. The question now that one of the questions is, will it behave like these other viruses? And they have a more, and that's one of the discussions and also one of the unknowns, they have a more seasonal reappearance, so they're more bound to the winter and the spring and the autumn, and less in the early summer. But so we will see whether that will have an impact.